So this machine here is an ultrasound machine. Sonocyte's the brand. We use it to guide us and help us with nerve blocks and central line placement, sometimes with difficult IV access. So it's got a lot of usage within medicine. It's the same, technology that they would use to look at a baby before they're born and do an ultrasound on that. Certainly there are different types of probes, and two of the main things about each of these probes. So this one's a little smaller. Here's another one that's a little bigger. One that you would use on the belly to actually see a baby would probably be even bigger than this.
Mm-hmm.
And the qualities that they have are the resolution and the penetrance. So usually, often, it's not exactly the case, but often the smaller the probe, the higher the resolution, so the better the picture.
Yeah.
But it doesn't go as deep. It doesn't see as deep. So I'll use this little probe, and I'll put it on myself and show you you can come on in. Go ahead and put this little probe, and I'll put it on my neck, and I'll show you. So you saw that the screen went from black here. This is what it looks like when there's no lubricant on. In a second here, you see a little gray area. If I mess with it, you can see it kind of making a little bit of a different picture. And I'm going to bring it back to this small probe. The lubricant helps to improve the quality of the picture, basically acting as an intermediary between the probe and my skin. So I put it on there, and the first thing I see is that I'm dehydrated. I'm showing you that I'm in the upright position. This is my carotid artery, and some of the neat things that you can do with an ultrasound are to put color on it. So if I change the mode to color, I can see pulsatile flow, and that's every beat of my heart, that thing's pulsating, and that's my carotid artery. So that's blood going from my heart up to my brain on the right side. Okay, and then I take the color off, change it back to 2D or two-dimensional, and this little thing here is my collapsed, dehydrated internal jugular vein. So
how would it look if it was hydrated?
If I lay down like that, if I'm like, take a picture of me, see what I did there?
I got it.
And now go back here.
Okay.
See? And then I come back up, stand straight up. So if I were laying down, I'd get a nice bigger circle vein, and if I were very hydrated, I'd get a even better looking vein. But this kind of shows that I probably should drink a little water. And then a lot of times for heart surgery, you stick IV, a big IV, in this vein here. So, and then it helps you. It's called a central line. You can float a little catheter within that central line to measure pressures within the heart, and you can also administer blood, fluids, medications in a quick manner. And that's done before a lot of heart surgery and before other types of major surgeries as well. Or when you can't get a good IV. If you just struggle and you can't get a good IV, even with ultrasound help, you can put in a central line. Some people have diseased carotid arteries. So I talked about the vein here and central lines. This is, you would not put a line in here. You want to put lines in veins, but you would not put a line in here. But some people have diseased carotid arteries, and you would see a lot of plaque protruding in here if I did, and because of that, they can have strokes. They can send emboli from this a plaquey carotid artery to their brain, or they can just occlude carotid blood flow. And if patients had poor circulation here and a lot of disease in here, surgeons do a procedure called a carotid endarterectomy, and they fix that, and that helps prevent further future stroke. And they can also put stents in that area too. So if I come out laterally, let's see what I see here. All right, so I'm going to try and show you some nerves now.
About how deep is it? Like, is it
2.6 centimeters is here, and I can decrease the depth. I mean, increase the depth that way. I can decrease it. 1.9 is the lowest it goes. This thing here, this white structure, is probably now my first rib. I came into a different area of the neck, so this pulsating vessel might be the subclavian artery, and these are nerves. This little thing is a bundle of nerves, and those are the nerves that are called the brachial plexus, and give much of the innervation to the arm, so they make my arm move and feel. And I'm going to travel up in the neck a little bit from that area, which is close to the rib, right above the clavicle. I'm going to travel up, and I still see some nerves. They're kind of spreading apart. I think those are nerves. I think those are nerves. But this little area is where you might do a nerve block for shoulder surgery. So these are little parts of nerves. Some think they're roots, some think they're trunks. Basically, the nerves of the cervical and thoracic spine come out, they become roots, they become trunks. I'll travel down again. Then they're called divisions, cords, and then peripheral nerve. And if I showed you my armpit, which I don't know that I need to right now, I could show you different peripheral nerves. These things become down at the armpit level. So anyway, this is, I could do a nerve block right here. I could stick a needle in, put numbing medicine around these nerves, and then anesthetize the whole arm, and a patient could have wrist or hand surgery awake.
so it would just paralyze the nerve?
Correct. It would paralyze the nerves for about, depending on the medicine I give, for several hours. And again, if I travel up here, I'm going to see these, this like snowman 1, 2, 3 picture. I'm traveling up to see what it looks like. But this would probably be where I'd go to do an interscalene nerve block, which is a nerve block for shoulder surgery. And if I'm coming posterior, anterior, trying to just get oriented here. These are your nerve trunks maybe. This is your anterior scalene muscle. This is your middle scalene muscle. And these are the nerves that you would block to have a patient get pain relief after shoulder surgery. And it's called an interscalene, between scalene between two muscles, interscalene nerve block. So that's neat, huh?